How to treat and cure colorectal cancer. In cancer care, different types of doctors often work together to create a patient's overall treatment plan that usually includes or combines different types of treatments. Descriptions of the most common treatment options for colorectal cancer are listed below, followed by a brief outline of treatment options listed by stage. Treatment options and recommendations depend on several factors, including the type and stage of cancer, possible side effects, and the patient's preferences and overall health. Your care plan may also include treatment for symptoms and side effects, an important part of cancer care. Take time to learn about all of your treatment options and be sure to ask questions about things that are unclear. Also, talk about the goals of each treatment with your doctor and what you can expect while receiving the treatment. Learn more about making treatment decisions. Surgery. Surgery is the removal of the tumor and some surrounding healthy tissue during an operation. This is the most common treatment for colorectal cancer and is often called surgical resection. Part of the healthy colon or rectum and nearby lymph nodes will also be removed. While both general surgeons and specialists may perform colorectal surgery, many people talk with specialists who have additional training and experience in colorectal surgery. A surgical oncologist is a doctor who specializes in treating cancer using surgery. A colorectal surgeon has additional training beyond education in general surgery. In addition to surgical resection, surgical options for colorectal cancer include laparoscopic surgery. Some patients may be able to have laparoscopic colorectal cancer surgery. With this technique, several viewing scopes are passed into the abdomen while a patient is under anesthesia. The incisions are smaller and the recovery time is often shorter than with standard colon surgery. Laparoscopic surgery is as effective as conventional colon and rectal surgery in removing the cancer. Surgeons who perform laparoscopic surgery have been specially trained in that technique. Colostomy for rectal cancer. Less often, a person with rectal cancer may need to have a colostomy. This is a surgical opening, or stoma, through which the colon is connected to the abdominal surface to provide a pathway for waste to exit the body. Such waste is collected in a pouch worn by the patient. Sometimes, the colostomy is only temporary to allow the rectum to heal, but it may be permanent. With modern surgical techniques and the use of radiation therapy and chemotherapy before surgery when needed, most people who receive treatment for rectal cancer do not need a permanent colostomy. Learn more about colostomies. Radiofrequency ablation. Some patients may be able to have surgery on the liver or lungs to remove tumors that have spread to those organs. Another way is to use energy in the form of radiofrequency waves to heat the tumors, called radiofrequency ablation or RFA. Not all liver or lung tumors can be treated with this approach. Sometimes, RFA can be done through the skin or during surgery. While this can spare the liver and lung tissue that might be removed in a regular surgery, there is also a chance that parts of tumor will be left behind. Side effects of surgery. Talk with your healthcare team about the possible side effects of the specific surgery beforehand, and ask how they can be prevented or relieved. In general, the side effects of surgery include pain and tenderness in the area of the operation. The operation may also cause constipation or diarrhea, which usually goes away after a while. People who have a colostomy may have irritation around the stoma. If you need to have a colostomy, the doctor, nurse, or an enterostomal therapist, who is a specialist in colostomy management, can teach you how to clean the area and prevent infection. Many people need to redrain their bowel after surgery, which may take some time and assistance. You should talk with your doctor if you do not regain good control of bowel function. Learn more about the basics of cancer surgery. Radiation therapy. Radiation therapy is the use of high-energy X-rays to destroy cancer cells. It is commonly used for treating rectal cancer because this tumor tends to recur near where it originally started. A doctor who specializes in giving radiation therapy to treat cancer is called a radiation oncologist. A radiation therapy regimen, schedule, usually consists of a specific number of treatments given over a set period of time. External beam radiation therapy. External beam radiation therapy uses a machine to deliver X-rays to where the cancer is located. Radiation treatment is usually given 5 days a week for several weeks. It may be given in the doctor's office or at the hospital. Stereotactic radiation therapy. Stereotactic radiation therapy is a type of external beam radiation therapy that may be used if a tumor has spread to the liver or lungs. This type of radiation therapy delivers a large, precise radiation dose to a small area. This technique can help spare the liver and lung tissue that might be removed during surgery. However, not all cancers that have spread to the liver or lungs can be treated in this way. Other types of radiation therapy. For some people, specialized radiation therapy techniques, such as intraoperative radiation therapy or brachytherapy, may help get rid of small areas of cancer that could not be removed with surgery. Intraoperative radiation therapy. Intraoperative radiation therapy uses a high, single dose of radiation therapy given during surgery. Brachytherapy. Brachytherapy is the use of radioactive seeds placed inside the body. In one type of brachytherapy with a product called spheres, tiny amounts of a radioactive substance called yttrium-90 are injected into the liver to treat colorectal cancer that has spread to the liver when surgery is not an option. While limited information is available about how effective this approach is, some studies suggest that it may help slow the growth of cancer cells. Radiation therapy for rectal cancer. For rectal cancer, radiation therapy may be used before surgery, called neoadjuvant therapy, to shrink the tumor so that it is easier to remove. It may also be used after surgery to destroy any remaining cancer cells. Both approaches have worked to treat this disease. Chemotherapy is often given at the same time as radiation therapy, called chemoradiation therapy, to increase the effectiveness of the radiation therapy. Chemoradiation therapy is often used in rectal cancer before surgery to avoid colostomy or reduce the chance that the cancer will recur. One study found that radiation therapy plus chemotherapy before surgery worked better and caused fewer side effects than the same radiation therapy and chemotherapy given after surgery. The main benefits included a lower rate of the cancer coming back in the area where it started, fewer patients that needed permanent colostomies, and fewer problems with scarring of the bowel in the area where the radiation therapy was given. Chemotherapy. Chemotherapy is the use of drugs to destroy cancer cells, usually by stopping the cancer cell's ability to grow and divide. Chemotherapy is usually given by a medical oncologist, a doctor who specializes in treating cancer with medication. Systemic chemotherapy gets into the bloodstream to reach cancer cells throughout the body. Common ways to give chemotherapy include an intravenous, tube placed into a vein using a needle or in a pill or capsule that is swallowed, orally. A chemotherapy regimen, or schedule, usually consists of a specific number of cycles given over a set period of time. A patient may receive one drug at a time or combinations of different drugs at the same time. Chemotherapy may be given after surgery to eliminate any remaining cancer cells. For some people with rectal cancer, the doctor will give chemotherapy and radiation therapy before surgery to reduce the size of a rectal tumor and reduce the chance of the cancer returning. Targeted therapy. Targeted therapy is a treatment that targets the cancer's specific genes, proteins, or the tissue environment that contributes to cancer growth and survival. This type of treatment blocks the growth and spread of cancer cells while limiting damage to healthy cells. Recent studies show that not all tumors have the same targets. To find the most effective treatment, your doctor may run tests to identify the genes, proteins, and other factors in your tumor. This helps doctors better match each patient with the most effective treatment whenever possible. In addition, Many research studies are taking place now to find out more about specific molecular targets and new treatments directed at them. These drugs are becoming more important in the treatment of colorectal cancer. Learn more about the basics of targeted treatments. Types of targeted therapy. For colorectal cancer, the following targeted therapies may be options. Talk with your doctor about possible side effects for a specific medication and how they can be managed. Antiangiogenesis therapy. Antiangiogenesis therapy is a type of targeted therapy. It is focused on stopping angiogenesis, which is the process of making new blood vessels. Because a tumor needs the nutrients delivered by blood vessels to grow and spread, the goal of anti-angiogenesis therapies is to starve the tumor. Bevacizumab is a type of anti-angiogenesis therapy called a monoclonal antibody. When given with chemotherapy, bevacizumab increases the length of time patients with advanced colorectal cancer live. Epidermal growth factor receptor, EGFR, inhibitors. An EGFR inhibitor is a type of targeted therapy. Researchers have found that drugs that block EGFR may be effective for stopping or slowing the growth of colorectal cancer. Cetuximab and panitumumab are monoclonal antibodies that block EGFR. Cetuximab is an antibody made from mouse cells that still has some of the mouse structure. Panitumumab is made entirely from human proteins and is less likely to cause an allergic reaction than cetuximab. Recent studies show that cetuximab and panitumumab do not work as well for tumors that have specific mutations, or changes, to a gene called RAS. ASCO released a provisional clinical opinion recommending that all patients with metastatic colorectal cancer who may receive anti-EGFR therapy, such as cetuximab and panitumumab, have their tumors tested for RAS gene mutations. If a patient's tumor has a mutated form of the RAS gene, ASCO recommends against the use of anti-EGFR antibody therapy. Furthermore, the FDA now recommends that both cetuximab and panitumumab only be given to patients with tumors with non-mutated, sometimes called wild-type, RAS genes. Side effects of targeted therapies. Talk with your doctor about possible side effects for a specific medication and how they can be managed. The side effects of targeted treatments can include a rash to the face and upper body, which can be prevented or reduced with various treatments. Find out more about skin reactions to targeted therapies. Treatment options by stage. In general, stages 0, 1, 2, and 3 are often curable with surgery. However, many patients with stage 3 colorectal cancer, and some with stage 2, receive chemotherapy after surgery to increase the chance of eliminating the disease. Patients with stage 2 and 3 rectal cancer will also receive radiation therapy with chemotherapy either before or after surgery. Stage 4 is not often curable, but it is treatable and the growth of the cancer and the symptoms of the disease can be managed. Clinical trials are also a treatment option for each stage. Stage 0 colorectal cancer. The usual treatment is a polypectomy, or removal of a polyp, during a colonoscopy. There is no additional surgery unless the polyp cannot be fully removed. Stage I colorectal cancer. Surgical removal of the tumor and lymph nodes is usually the only treatment needed. Stage 2 colorectal cancer. Patients with stage 2 colon cancer should talk with their doctor about whether more treatment is needed after surgery, as some patients receive adjuvant chemotherapy. This is treatment after surgery with chemotherapy aimed at trying to destroy any remaining cancer cells. However, cure rates for surgery alone are quite good, and there are few benefits of additional treatment for people with this stage of colon cancer. Learn more about adjuvant therapy for stage 2 colorectal cancer. A clinical trial is also an option after surgery. For patients with stage 2 rectal cancer, radiation therapy is usually given in combination with chemotherapy, either before or after surgery, and additional chemotherapy may be given after surgery as well. Stage 3 colorectal cancer. Treatment usually involves surgical removal of the tumor followed by adjuvant chemotherapy. A clinical trial is also an option. For patients with rectal cancer, radiation therapy may be used along with chemotherapy before or after surgery along with adjuvant chemotherapy.